Antidepressants can relieve symptoms of many mental health disorders. While they're most commonly prescribed for major depressive disorder (MDD), they are also used to treat anxiety, post-traumatic stress disorder (PTSD), bipolar disorder. Like any other medication, antidepressants can cause side effects. Whether they're mild or severe, common or rare, each type of antidepressant has its own unique set of possible risks. They range from physical health problems to worsening mental health symptoms. Not everyone suffers from the same ones. While one person may feel few or even no side effects, another person may have severe side effects from the same drug. Classes of antidepressant drugs. There are several classes of antidepressants. The antidepressant drug class that you use is important to know because it tells you how it works in your body. Many medications in the same class have similar side effects, though there's always at least a little variation. Some classes are more commonly prescribed than others. Selective serotonin reuptake inhibitors (SSRIs). These work by blocking your brain's absorption of serotonin. Serotonin is a neurotransmitter and a chemical that plays a big role in regulating your emotions, especially happiness. When SSRIs stop your brain from absorbing serotonin, the result is higher levels of the chemical, and that can boost your mood. SSRIs are very popular, and many of them are among the most commonly prescribed antidepressants. Serotonin and norepinephrine reuptake inhibitor (SNRIs). These medications help regulate both serotonin and norepinephrine. Norepinephrine is a chemical that helps with concentration and alertness. Tricyclics affect serotonin, norepinephrine, and acetylcholine. Acetylcholine is a neurotransmitter that activates muscles and is a major part of your nervous system. Tricyclic antidepressants are less commonly used. This is partly due to their side effects, which include increased heart rate and low blood pressure when moving from sitting to standing. This can be especially dangerous in elderly people. Monoamine oxidase inhibitors (MAOIs). These were the first antidepressants available. They work by affecting the neurotransmitters serotonin, norepinephrine, and dopamine. Dopamine is another neurotransmitter in your brain that helps regulate your emotional responses. It also helps control your brain's pleasure and reward centers. MAOIs are typically only used today as a last resort. This is because of their life-altering and potentially fatal side effects, including raising blood pressure to dangerously high levels when they interact with certain foods or medications. Common antidepressant medications and their side effects. Your unique medical history plays a role in determining your experience. It's crucial to talk to your doctor or whomever you see for your mental health about the benefits and risks before you start taking depression medication or stop. Read on to get an idea of what side effects you might expect from some of the most common antidepressants. Prozac fluoxetine. Drug class SSRI. Other brand names: Seraphim. Potential side effects: nausea and upset stomach, constipation, headaches, anxiety, sleep problems, cold symptoms, sexual dysfunction, including decreased sex drive and difficulty having orgasms, suicidal thoughts in children and adolescents. Citalopram. Drug class SSRI. Potential side effects: nausea and upset stomach, dry mouth, constipation, diarrhea, drowsiness, increased sweating or urination, cold symptoms such as sneezing, sore throat, and cough. Sexual problems, including decreased sex drive and difficulty having orgasms. Lexapro-escitalopram. Drug class SSRI. Potential side effects: nausea and upset stomach, heartburn, gas, ringing in the ears, yawning, dizziness. Sexual problems, including decreased sex drive and difficulty having orgasms. Weight gain or weight loss. Zoloft sertraline. Drug class SSRI. Potential side effects: stomach pain, upset stomach, and nausea. Constipation and/or diarrhea. Tiredness, headache, skin rash, changes in appetite. Sexual problems, including decreased sex drive, difficulty having orgasms, and abnormal ejaculation. Nervousness. Suicidal thoughts in children and adolescents. Paxil paroxetine. Drug class, SSRI. Other brand names, Paxiva, Bristol. Potential side effects, nausea, headache, restlessness, nervousness, dizziness, nasal irritation, constipation, decreased sex drive, erectile dysfunction, and difficulty having an orgasm. Yawning, ringing in the ears, sleep problems such as insomnia. Luvox fluvoxamine. Drug class, SSRI. Potential side effects, nausea, diarrhea, gas, loss of appetite, sore throat, dizziness, sleep problems such as insomnia or strange dreams, increased sweating, skin rash, heavy menstrual periods, muscle pain and weakness, yawning, sexual dysfunction, including decreased sex drive, abnormal ejaculation, and inability to have an orgasm. Effects or venlafaxine. Drug class, SNRI. Potential side effects, nausea, dizziness, constipation, nervousness, headaches, insomnia, strange dreams, increased sweating, high blood pressure, seizures, sexual problems such as erectile dysfunction and difficulty having an orgasm. Cymbalta duloxetine. Drug class, SNRI. Other brand names, Eranka. Potential side effects, nausea, tiredness, constipation and/or diarrhea, dizziness, insomnia, loss of appetite, liver failure in some people. Wellbutrin bupropion. Drug class, atypical antidepressant. This means it isn't in any of the other common categories of antidepressants. It works to inhibit your brain's absorption of norepinephrine and dopamine, resulting in an elevated mood. Other brand names, Zybin, Aplenzin. Potential side effects, nausea, vomiting, and stomach pain, agitation, headache, insomnia, constipation and/or diarrhea, blurred vision, ringing in the ears, sore throat, muscle and joint pain, skin rash or itching, increased sweating, increased urination, tremor, strange taste in the mouth, weight gain or weight loss, risk for seizures. Elevol amitriptyline. Drug class, tricyclic. Other brand names, Endip. Potential side effects, dizziness and lightheadedness, constipation, dry mouth, blurred vision, weight gain, confusion, swelling of face or tongue, skin rash, numbness or tingling in arms and legs. Nardilphenylzine. Drug class, Maoi. Other brand names, Nardilzine. Potential side effects, dizziness, headache, weakness, tremors and twitching, myoclonic jerking movements, weight gain, drop in blood pressure when moving from sitting to a standing position, skin rash. The decision of whether or not you should take depression medication, and which one, rests on you and your doctor. Side effects can play a role in your decision. Coping with the side effects of antidepressants can be stressful while you're already coping with depression. There are alternative treatments for depression, including TMS therapy. TMS is drug-free and avoids the side effects associated with antidepressants. With help from your doctor and a willingness to try new things,